Five, four, three, two, and one.
Good evening. My name is Arturo Valdez, and I am the Los Angeles County Deputy Superintendent. Thank you so much for joining us tonight's virtual town hall event for teachers and education staff at K-12 schools hosted by the Los Angeles County Department of Public Health and the Los Angeles County Office of Education. We have lots to discuss, as you all know, but to start, I want to introduce our panelists and tell you who's here today. We have Dr. Barbara Ferrer, who is the director of the Los Angeles Department of Public Health. We also have Dr. Deborah Duarto, the superintendent of the Los Angeles County Office of Education, and Dr. Robert Gilchek, the Child and Adolescent Health Section Chief at the Los Angeles County Department of Public Health. And a bonus, we have Dr. Nava Yagane, a physician at the LA County Department of Public Health. First, I want to tell you a little bit about how the town hall will go tonight. To start, our speakers will provide brief remarks on a variety of topics, and then we'll transition to the question and answer. So far, we have received over 500 questions ahead of time. We won't be able to answer all of them, but we're going to do what we can to get to as many as possible. You can still submit questions during the town hall in the chat box, and we'll get to them shortly. Well, let's get started. To start, I'd like to introduce Dr. Deborah Duarto, the superintendent of the Los Angeles County Office of Education, for her opening remarks. Dr. Duarto.
Thank you, Mr. Valdez, and thank you to everyone who have joined us tonight, especially our educators, school staff, administrators, our district leaders, parents, and students. We're so happy that you're able to join us. I also want to thank the LA County Department of Public Health for their continued partnership and collaboration. Everyone's efforts and support during this time are invaluable and significant for LA County public schools and communities. We're a few weeks out from since it's been 1 year mark since school campuses were closed due to the pandemic. And this pandemic has taken a significant toll on many people. We've lost lives. We are grieving together. We have students who have been isolated and in distance learning, educators teaching from home and supporting their own families, district leaders working around the clock to get supports going for students that need it most, parents trying their very best to support their children in distance learning, and students working hard and adapting to their new learning environments. These really are unprecedented times. It's an understatement to say that. And tonight you'll hear from me and our partners at LA County Department of Public Health on new reopening protocols and plans for vaccinating our educators and our school staff.
Thank you, Dr. Duarto. Appreciate that. I'd now like to turn to Dr. Barbara Ferrer for her opening remarks. Dr. Ferrer.
Oh, thank you so much, Deputy Superintendent Valdez, and thank you so much, Superintendent Duarto. I'm just really honored to be here with you tonight. The partnership that we've had with the LA County Office of Education, I think, has made it for all of us a real team effort in really making sure that we're taking care of our children, students, families, teachers, staff, and administrators. And I really have valued our ability to be able to rely on both of you, especially for your wise counsel. I also want to acknowledge and thank Dr. Gilchek and Dr. Yagane from the Department of Public Health, who are part of our education team. And many of you may be familiar with both of them as they've been out and about in the communities, really helping to make sure that we're supporting schools in every way possible. It was our job to support schools before COVID-19 became a pandemic here in LA County, and it remains our job to support COVID-19, the COVID-19 response during the pandemic. And we're going to be with all of you after the pandemic is over as well, because we really understand that it takes all of us to make sure that every single child can thrive and every family feels supported in making decisions to help ensure that their child can be successful academically and that their child has all that they need to be physically and emotionally well. So we're in this partnership way beyond tonight's conversation and way beyond the pandemic. But in terms of the pandemic, it has been challenging, and I want to really thank every single person in the school community. We often at Public Health feel like, this has been a super difficult year for everybody who works at this department. And there's only one other group of folks that I think for all of us, we feel this has been an equally challenging and difficult time, and that's all of you. You have had to really continue to do everything you can to help children thrive in really the most difficult situations. So I want to just start by thanking everyone and really acknowledging what a debt of gratitude we owe to every single person who's been part of that school community. I also want to note that we're in a better place today than we were in November, December, and January. And I'm grateful because I know for a fact that we're only in this better place because lots of people got back into the game, made really good decisions, protected each other, and you've allowed our case rates to fall. And our case rates have fallen significantly, almost 90% since the middle of January. That's a very steep decline. We did have a very steep increase, but we are starting to see a similar trend where our case numbers are down, our hospitalization numbers are down, and we're starting finally to see slightly lower numbers of people dying every day. And because the case numbers are down, and those case numbers are in fact what drive hospitalizations, and unfortunately they drive the deaths. With the case numbers down, we now, as many of you know, qualify under the state's framework for careful reopening of schools where a school community has made the decision to reopen for students in grades TK through grade 6. And we're here again to support the choices that school communities make. If the choice is to reopen, we provide technical assistance and support both on the reopening and should there be challenges as you bring teachers, staff, and students back onto your campuses. Should your schools not choose to reopen for full instruction, in-class instruction for students, we're still here. And we still help you. As we know, many of you have daycare programs running on your campuses, you're running meal programs, many of you are providing support for high-need students. So in whatever way possible, we are here to be a support. And we're also excited about the opportunity starting March 1st to begin offering vaccinations for teachers and staff who work at our schools throughout the county. And we will, of course, be doing this in partnership with the LA County Office of Education. It will be a tough road for at least the next 4 to 6 weeks because we do have scarcity of supply, but we're anxious to get started and really make a difference in adding an additional layer of protection, because that's what it is. It's really an additional layer of protection. We know that many of you are working in schools right now, and those schools have a set of safety protocols in place that are meant to create a lot of safety in that school building. They require mandatory wearing of face coverings, they require mandatory distancing, and a whole host of infection control protocols. And that we know those protocols are in fact effective at reducing spread, because we've all been around for a year now trying to figure out the best ways to offer some protection in the middle of a pandemic with what is in fact a very dangerous virus. But I'm going to close now just with our pledge, which is, we're here for you. We're here to be of service to everybody in the school community. And tonight we're looking forward to really answering your questions. I'll turn it over to Dr. Gilchick to provide more detail on reopening.
Thank you, Dr. Ferrer. I appreciate that. And I'm very, very pleased to be able to meet with all of you tonight. And thank you all for taking the time to meet with us, and I look forward to answering questions. But I'm going to start by just speaking for a couple of minutes with a little more detail about the school reopening process, our protocols, and the safety measures that the protocols call for. First of all, as you all know, the state allows reopening of grades TK through 6 when our county falls below an adjusted case rate of 25 cases per 100,000. That's a rate calculated by the state. And Monday was the 5th consecutive day that we were below that threshold. And therefore, as of the following day, all schools in the county have the opportunity to bring back students in TK through 6 when the school is ready to do so and able to do so safely. First, many people ask, where does this number 25 come from? What's magic about that? There's nothing magic about it, but it does come from some research and analysis, largely from a report by the Harvard Global Health Institute that did a sort of a meta-analysis of school reopening, and it seemed that that was a rate above which community transmission is so high, it's extremely difficult to avoid outbreaks in school settings and to keep schools open. Below that rate, it becomes more feasible to do so with a number of different layered mitigation strategies and safety measures, which I'll outline a little bit. So now that we're below that rate and schools are permitted to open TK through 6, first, schools that have already been open with a prior waiver for grades TK through 2 are approved to expand to grades 3 through 6 just upon posting their completed COVID safety plan to their website. That's all they have to do. So in a sense, those schools are grandfathered in because they've already proved or demonstrated their ability to operate safely. I'll talk a little more about what the COVID safety plan is in a minute. All other schools must post their plan and submit it for review to the state and county public health departments. And the plan is basically a summary and an attestation of the school's commitment and strategies to implement an array of safety measures to protect everyone in the school community. The plan consists of a Cal OSHA COVID-19 prevention program, which really is aimed at protecting employee health, a California Department of Public Health school guidance checklist, which documents the planned and layered mitigation strategies that will be employed. And this checklist includes a requirement that the school consult with labor organizations, parents, and community-based organizations before opening. If there's no labor organization, for example, as is true of many private or independent schools, the school still needs to describe how staff were consulted prior to reopening. Does not necessarily require agreement or approval by labor, but it does require consultation. And lastly, our own local Los Angeles County Department of Public Health reopening protocol for K-12 schools, which is a very detailed checklist of safety measures. Much is required, some of it is recommended, but every area in the protocol must be addressed by the school, and that must be completed and posted and available to anyone at the school before the school can reopen. Now, once all of this is submitted to us, the county has 7 business days to review the plan and all of its parts for any deficiencies and to respond and ask for more information. If there is no response within 7 business days, the plan in the school is approved for reopening on the 8th day after submission. Let me tell you a little bit about the safety measures that are included in our protocol, all of which must be addressed. Masking is required for all in the school, all age groups, all grades, all employees. Physical distancing of a minimum 6 feet between students and staff is expected. 4 feet minimum is allowed if there are other barriers in place and 6 feet of distance is not feasible for the school. However, they must explain why it's not feasible. Less than 4 feet of distance is not allowed at any time. Stable groups or cohorts of students and instructors is extremely important to avoid or to limit transmission of cases if it does occur within a particular cohort or group. Hand hygiene is emphasized, increased cleaning of high touch points and surfaces, an exposure plan for when cases are identified, including case reporting to public health, which is required, assistance with contact tracing, isolation and quarantine, communications with students, staff, and parents, and in some instances, the launch of an outbreak investigation led by public health. When a cluster of cases is identified that meets our outbreak definition, improved ventilation needs to be addressed. And lastly, testing of staff and students, which at a minimum requires testing of all symptomatic persons and close contacts to confirm cases of COVID-19. The last point I'll make is to let you know about our school technical assistance team, or STAT team, which offers assistance as needed so schools can reopen safely. And we're committed to having a subject matter expert do at least one site visit and walkthrough of every school facility that reopens for student instruction. We actually launched this program back in September when schools began to bring back small cohorts of high-need students for special services. And we've actually, at this point, visited over 1,000, well, exactly 1,354 schools. But we are a very large county with over 3,000 public, charter, and private schools. So we have a lot of visits left to do, and we're looking forward to meeting some of you and serving all of you. And with that, I will turn it over to Dr. Yagana.
Great. Thank you so much. I also want to echo everyone's thanks on this call. As a pediatrician, I can't overemphasize the importance of educators on the health of my patients. So as many of you are aware, COVID-19 has not only changed and disrupted every aspect of our life, it's caused loss of life, loss of jobs, it's damaged the mental health of everyone and our sense of well-being, and it's resulted in the loss of educational and social emotional opportunities for our children, and resulted in increased isolation in our elderly. We're all extremely excited and motivated to do whatever it takes to decrease the impact of this disease on our society and in our personal lives. As we are moving to offer the vaccine to the childcare and education sector, we have this extraordinary opportunity to protect ourselves, our families, our friends, and our students. As essential workers on the front lines, the education sector is being prioritized over many other groups to receive a life-saving vaccine. We all know there's a scarcity of doses and many are excited to get in line, but schools and childcare are being given priority because they provide an invaluable service to our community. I wanted to spend a few minutes talking about the vaccines that are available. We currently have 2 vaccines that have received emergency use authorization after completing their phase 1, phase 2, and phase 3 trials, with over 30,000 volunteers for the Moderna vaccine and 44,000 volunteers for the Pfizer vaccine. These individuals were of various ages, ethnic groups, and racial groups, and they had several of them, at least 1/3 to 1/4 of them had underlying conditions. Although every effort was made to make this vaccine available to the general public as soon as possible, it's important for everyone on this town hall to know that there was no cutting of corners and there were no skipped steps. These were robust, large-scale trials involving more than 100,000 individuals with scientific oversight at every level. There were thousands of volunteers across races and ethnicities who wanted to participate in these trials, and billions of dollars were poured into the process so scientists were able to move ahead with their work and perfecting the ideal vaccine without any concerns for financial restrictions. Finally, production was accelerated so the vaccine could be made available almost immediately after it received emergency use authorization from the FDA. So what did these trials show? Well, we know that the Pfizer and the Moderna COVID vaccines seem to be well tolerated. They're extremely safe and 95% effective at preventing COVID-19 disease. Even more impressive, they're 100% effective at preventing death or severe illness. These results are truly a cause for celebration. Although these vaccines are incredibly safe, we want to be transparent and make sure everyone recognizes that they may be more reactogenic than other vaccines. Then that basically means that after you receive the vaccine, you might have some more pain or swelling at the injection site, and a lower percentage may have about 24 hours of fever, chills, fatigues, or muscle aches. These vaccines have now been administered to millions of people, and all the adverse events are being reported to the CDC through 2 different monitoring systems. One is an active monitoring system you can sign up for, where you will be contacted about your symptoms after receiving the vaccine. The other one is VAERS, or the Vaccine Adverse Events Reporting System, and this is a passive vaccine monitoring system. And if you are a clinician and you know of an adverse event, you're mandated to actually report these to the CDC. And the CDC does share this information with all clinicians regularly. Given that COVID has had such devastating impact in our society, we're incredibly privileged to have this additional tool to prevent COVID-19 related disease and death. And we're very excited to be able to offer it to the education and childcare sectors. Thank you.
Thank you, Dr. Yagane, for that. And thank you to all of our panelists. Now we're going to get started with questions that you all have sent through. We'll get to as many as possible, but as a reminder, you can also submit questions during the town hall in the chat box. So please take advantage of that. So let's start with the first question, which goes to Dr. Farrar. And here is the question. Dr. Farrar, I'm a teacher in Glendale, and I'm worried that we'll just end up closing again. What can we do to open and stay open for good? And why the rush to open before vaccines are made available to teachers?
That's such a good question, and thank you so much, I think, for highlighting 2 very important issues for us. The first is, are we on a yo-yo with schools? Because we've all experienced the yo-yo that we've had with our other sectors, business sectors that have opened. Stores open, then they close. Businesses are allowed to serve food for a while, our restaurants, and then we say the risk got too high. I think the good thing about schools is once you're opening now, you really get to stay open unless there was another huge surge and we had to issue a health officer order that would really essentially send everyone back home, or there were so many cases in your school community that the Department of Public Health decided there was just too large an outbreak. And the only way to actually dampen the transmission in that environment was to actually close that school for usually what's a period of 2 weeks, 14 days. That's the incubation period. But it is not the case for schools that are reopening now that if our case rate, for example, which is very likely, and we've all experienced it, if our case rate goes back up, it's now, I think, about 19 cases per 100,000, the adjusted rate. Let's say, 2 weeks from now, because we had the Super Bowl weekend, we had our holiday weekend. In both of those circumstances, sometimes in the past have led us to have an increase in cases. So let's say we did see a slight increase in cases and the case rate went back up 2 weeks from now to 27 cases per 100,000. We would not be asking schools that are open to close again. That's not the way this works. This reopening is really meant for us to work really hard in the school environment to keep things as safe as possible. But I will say that if you look at any of the graphs that we've put up over the last 4 months, it is clearly apparent that if community transmission gets very high, we see more cases in the school buildings. We see more cases at the grocery stores. We see more cases in the factories. We see more cases at the restaurants. Once community transmission starts going way back up, There just is exactly that, a lot of transmission, and it happens everywhere. And then people who are out and about bring it back into their houses, and it goes back out again. So it really is the best way to make sure that schools don't have a lot of community transmission once they're open, because that could lead to outbreaks in the school community, is for, in fact, us to do our very best to keep community transmission down. And we always say this, and I know it's hard to understand. When more things are reopening with a lot of safety attached to those reopenings, absolutely not the time to let down your guard. As a matter of fact, it's exactly the opposite. It is a time to do even more to keep yourself safe, to reduce intermingling with other people when you don't need to. I always say to parents, you know, if your child is now going to school or to childcare, then what you really need to cut out are the play dates that you normally would have wanted to schedule when they got home, because you don't want to have additional risk factors introduced into you know, what already is a fair amount of community transmission, and that will hold true for all of us. But no, we're not going to really go up and down the same way we do with other sectors, but we do all have to do our best to keep community transmission rates down. And then there's a whole set of protocols at schools, and it can't be when it's convenient we do them, and when it's not so convenient we don't. The only way this works is if everybody is doing it all of the time in the school buildings. And we're going to ask parents and children to do their part also. It's not just teachers and staff and administrators. Every single person in the building has to, in some ways, take a personal pledge to be part of the solution, and that means following all the rules. We all have to make sure everyone understands the rules, but the way we're going to get through this and keep schools open, which we now have seen many countries have been able to do, is in fact if we all agree we're going to play by the rules. The rules aren't unreasonable, but they are different, and it creates a different environment at the schools. And I think it's a good question to ask, why not wait till everyone gets vaccinated? And I think the answer for that is you know, everybody's going to need to make, and every school district is going to need to make their choice about whether this added layer of protection is essential before you're going to open the building. I can tell you that we have millions of essential workers that go to work every day, and we try to do the same thing, create environments at their workplaces with directives to keep them and customers as safe as possible. None of us would actually have survived this past year if our food industry had shut down. None of us would have survived this past year if the ports had closed. None of us would have probably gotten through this year if our public safety officers weren't on the jobs. So there are lots of people who are still going to work every day to provide essential services, and they're doing so in the hope that they too are in a community where everyone is doing everything possible to adhere to the protocols. There is no sector that is allowed to be open for business that doesn't have a set of directives about safety protocols, that doesn't have to adhere to masking, that doesn't have to adhere to distancing, that doesn't have to adhere to testing in some situations, and in others to protocols that actually are, you know, very deep on infection control. So schools are not being singled out as, you know, a site where we would ask workers to go before they get vaccinated, when all other places, everybody else is already vaccinated. The only sector that already is vaccinated are healthcare workers, and we all know that they have been at the job since day one, way before there were any vaccinations available. They were vaccinated to make sure that the rest of us, if we get sick, actually have a standing healthcare system. So I appreciate that, you know, people and school districts are going to need to make a decision about when is it the right time to bring folks back into the building, and you're going to have to weigh all of the concerns that parents have rightfully, that teachers have rightfully, that staff have about when is the timing going to work. But I do want to note that we ask lots of people to go to work right now, and the only protections that we're offering them are the same protections schools will have. These directives that actually set forth by law conditions under which schools would be allowed to open, similar to what we do at grocery stores, at factories, at the ports, in our entertainment industry, And really, for all of us, even in our personal lives, we try to, in fact, say, here are the ways for us to protect each other.
Thank you, Dr. Ferrer. I'd like to now go to the next question, which is directed at Dr. Duarto. Dr. Duarto, the pandemic has been hard on mental health of students, as we all know. There'll be a lot of work to do on that front, but what is Laco doing to help staff and teachers who are struggling? You're on mute, Dr. Duarto. All right, we might have lost Dr. Duarto, but we will move on until she gets back. We're going to go to the third question, which I think is addressed to Dr. Gilchek. Dr. Gilchek, what will happen if there's an outbreak at a school, and how will staff be notified?
Thank you, Mr. Valdez. Can I be heard?
Yes.
Okay,
Yes.
great. Okay, very good. That's a good question. That's important. So first of all, how is an outbreak identified? Let's start there. So schools currently must report all cases that occur on their campus, students and or staff, to public health. A cluster of cases is more than one. 2 or more is a cluster. If there's a cluster of 3 or more cases that occur within a specified time frame, which is 14 days, and there appears likelihood of some sort of linkage between those cases, which generally means that some of those folks at least were in the same place at the same time, right? That's a likely linkage, or an epidemiologic linkage, we call that. It is very likely that our public health department would declare that an outbreak. At that point, our outbreak management bureau assigns a team, and we take very aggressive measures to work with the school, to investigate, to do our best to identify all possible exposures, to make sure people who are exposed are notified as quickly as possible. So of course, the person who is a case is isolated and excluded from the school until they serve out their isolation and they recover. Folks who are identified as close contacts are put under quarantine, which is like isolation, but the difference is they're not sick. We're putting them under quarantine to see if they become ill over the next 10 days, 10 to 14 days, I should say. And in addition, there is a communication plan. So the second part of the question is, how will staff be notified? And not just staff, but the entire community. Parents would need to know. They'd certainly want to know. Students probably would like to know as well. So how those communications going to happen? And it does depend whether someone is an exposure or not an exposure. So someone who is an exposure is obviously a priority to be notified as quickly as possible. And they would probably be told, you've been identified as someone who's been exposed to a confirmed case of COVID-19. You should go and get tested, highly recommended, very important. But they also need to quarantine from, everyone, really, everyone at the school and socially, as well as even their family members, ideally, so that if they happen to be infected, they won't spread it or transmit it to other people. No one's going to be told the name of a person who is a case of COVID-19. That's actually illegal. It violates HIPAA regulations. It shouldn't be done. A patient's privacy has to be maintained to the extent possible. It's quite now, if someone says, you were exposed on this date, around this time, it's very likely, you may know, well, I happen to be in the faculty lounge that day with Ralph. There wasn't anyone there. I guess I know who the case is. That's fine. if you can deduce that, that's fine. But no one's going to tell you it was Ralph or it wasn't Ralph. That we don't share that kind of information. Similarly, your identity, if you're an exposed person, is also protected. So what about everyone else? Well, everyone else doesn't necessarily need to know all the details about the case either, but everyone else probably would like to be informed that there was a case on campus, that that people who are exposed have been notified, that it has been contained to the best of our ability. If it has been contained, we've identified the index case and the contacts, and they've been isolated and quarantined respectively. And any affected areas have been cleaned and disinfected, and that you're being notified, when it's safe to return to the school, which may be immediately, that may be the next day. If there's an outbreak, there may be a need for a short-term closure of the school. I think that's a later question that we're going to talk about. Well, this is the outbreak question. So it may be that there's even a short-term closure of the school needed. Public health will determine that, along with consultation with school staff, and obviously if the school needs to be closed for 1 day or more, or 14 days or however long, everyone's going to be notified of that, and when it's safe to return. So that there are templates, letter templates on how to contact staff, or what to send to staff, or what to send to parents and families. Public health is available to assist with communication efforts. That's part of our mission. That's part of our duty to do that. And I think that everyone is equally committed to transparency, so people understand what may have occurred, what the risk is, if there is any, if there is any remaining risk, and when the risk is contained, and when it's okay to go back to school, which again might just be the next day. If it's a single case that's contained and excluded, and there's no indication of further transmission, and the regular cleaning and disinfection has been done, then it's probably determined that the school would be safe to continue operating in that situation. So every situation is unique. It requires attention and analysis to decide what to do. But I do think that there's an expectation that everyone will be informed what they need to know. You may not expect to get all the details of a case, that public health receives or that school administration knows, because there is confidentiality issues. But at the same time, I don't believe there's going to be any attempt to have secrecy, and not share what needs to be known in order to provide safety. I think I'll stop there. Thank you.
Thank you, Dr. Gilchick. Appreciate that. We're going to go back to Superintendent Dr. Deborah Duarto, and I'd like to repeat the question so everybody could hear it. The pandemic, Dr. Duarto, has been hard on the mental health of students, as we all know. There'll be a lot of work to be done on that front. What is Laco doing to help staff and teachers who are struggling?
So we've heard a lot about the mental health of our students and how concerned everyone is in terms of them being isolated, away from their friends, away from their teachers, away from their loved ones, and how difficult it's been for children. However, we know that it's been extremely difficult for adults as well. Our teachers, our paraprofessionals, our custodians, they are all dealing with the same pandemic. Their lives have been uprooted. They have been separated from their loved ones. They have seen people in their family become ill, and they've lost people to this virus. So this is a very difficult time for adults as well as children. I can tell you from my own personal experience, I had COVID just last month. It wasn't a fun experience. I was very sick. I had several people in my family that had it, and I've lost loved ones that I care deeply about. So I know how hard it is, and I know how worried people are and how scary this whole pandemic has been. And Laco is doing things to support not only our students, but to also support all of our educators, that include any employee that works at a school site. We have something that's called our EASE program. It stands for Employee Assistance Services for Educators, and we have offered that to all 80 of our district, and many of them have participated. And what that is we provide direct counselors 24 hours, 7 days a week. If someone is in crisis, if someone needs to speak to a counselor, they can call a number and immediately be connected to a counselor. You know, sometimes even if you have insurance, it's very difficult to get an appointment to see a mental health provider because so many people are seeking services. So I'm really happy that Laco offers that service to all of our educators and employees that are working at school sites. We've also entered into tremendous partnerships with the Department of Mental Health, and we've collected and shared resources and have given those out to all of our 80 districts in terms of services and supports that are available, hotlines, mental health resources that educators can call if they need support. We've also brought together a lot of level-alikes, a lot of counselors where we've done professional development to make sure that school-based counselors are prepared to support the staff at their site. Because we know that it won't just be the children that have suffered loss and the anxiety that comes with this type of pandemic. So we've done a lot of training for counselors. We've trained teachers on how to identify signs of risk. And so there's a lot of work that still needs to be done, but we absolutely understand that these mental health issues are not issues that simply affect children. They affect all of us, adults including. So we will continue to work with the 80 districts and provide resources and support so that all employees have access to mental health services should they need them. Thank you.
Thank you, Dr. Duarto. Great information. Our next question is directed at Dr. Ferrer. Dr. Ferrer, this is great news that we're opening for elementary schools. What do you think when do you think that we can reopen for middle and high schools?
Yeah, thanks so much. Another great question and much appreciated, and obviously a question that we get every single day here, and I'm sure Dr. Duarto and Mr. Valdez get it at their sites as well. We're all under a state's framework for how sectors are going to open, and that includes the educational sector. Right now, this county, although we're doing much better than we were last month, we're still in what's called the purple tier. This is where we still have widespread community transmission. In order for middle schools and high schools to open, and it's really 7th through 12th grade, it does not include 6th grade. As you know, 6th grade can open now. But for 7th through 12th grade to open, the county at this point, by the state regulations, would need to get into what we call the red tier. The red tier means that there's substantial transmission, but it's slightly less than the rates that you're seeing in community transmission in the purple tier. To put that in numbers, we're right now at about 18 cases per 100,000, according to the state's adjustments. We need to get to 7 cases per 100,000 to get into the red tier. Once we're in the red tier, 7th grade through 12th graders could, if their districts wanted them to, again, return to school. And I want to again say it's return to school with lots of safety protocols, and really at the heart of some of the struggles that present themselves with the 7th through 12th graders is the need to create more stable groupings. You really don't want to have a school with 2,000 students all on an individualized program coming in every single day with no cohorting. When there are exposures there, you've really had a lot of people get exposed. So that's one issue we all have to think about as we're preparing for 7th through 12th graders to come back, is how to make schedules work in a way that isn't really going to create as much exposure for the staff, the teachers, and the students. But I also know that many people in our county, educators and parents, have been speaking with us and speaking with the state about the need to perhaps adjust the framework that the state is using right now to take into account the fact that we now have vaccinations. When this framework was set up, we didn't have vaccinations, and so we really look at testing positivity rates and we look at case rates. Now that we have vaccination rates, there is an opportunity for the state to revisit that tiering and think about whether or not there's a metric that you would also want to use that would help guide the reopening, for example, of schools for students grades 7 through 12 that takes into account the level of vaccination that has happened in a community. But we'll keep you posted. I do want to emphasize that all schools in the district, public and private, can be open for students grades TK through 12 for students who have high needs. You can have up to 25% of the student body on the campus at any given time. They do have to be cohorted, so there are some special rules around grouping, or they have to be coming in for individualized services. But there are many schools that are already well over 1,000 that are bringing in students in grades 7 through 12 who are high need students, cannot be successful in virtual learning alone, and they're coming to the campus for a set of specialized services.
Thank you, Dr. Ferrer. Appreciate all that information. Next question goes back to Dr. Duarto. Dr. Duarto, how are you working with public health in prepping schools for the return of their students?
Well, we're working very, very closely. The great thing is that we have a wonderful partnership and very strong relationships that have been established. And these really were established prior to this pandemic when we were creating wellness centers at schools, because the Department of Public Health has been extremely committed to student wellness. So some of the ways that we're working together is, one, we have weekly conference calls with all 80 of our superintendents, trying to answer the questions they have regarding this pandemic, helping them to better understand the health orders, the language in the health orders. And Dr. Ferrer and Dr. Gilchick and any other members of her team have also joined on those weekly conference calls to engage with our superintendents and answer some of their questions. Besides the conference calls, we have multiple meetings a week where we are bringing in experts and educators, teachers, students to have conversations about reopening, and we've worked very closely on facilitating some of those meetings. At Laco, we're also collecting data, critical data that is needed, that we need to gather from our superintendent so that we can better understand how many students are on campuses, where districts are at in terms of their reopening plans, what type or in what format do they intend to come back. And we're gathering that information and sharing that with the Department of Public Health. So we create surveys and we work together with the Department of Public Health to really figure out exactly what they need to know so that they have the information they need. For example, we're gathering information on vaccinations and trying to better understand if districts have plans in place for vaccinating. Do they already have a partnership in place with a medical provider? Are they thinking about providing the vaccination themselves? This is all information that we gather and we share with the Department of Public Health that help us as we're moving forward and thinking about how we're going to vaccinate all of our teachers and educators and all people that work at school sites. We've also come together to advocate to the Board of Supervisors when we need additional support. We've been advocating at both the state and federal level for more resources to support education and schools. So we do work like that together, and we do a lot of problem solving with school leaders and address concerns and questions that they have. And we do that collaboratively with the Department of Public Health. And as I mentioned before, as I said, we were collecting data to help us decide how we're going to go about vaccinating educators. We've been partnering on the rollout of that vaccination process. Thank you.
Thank you so much, Dr. Duarto. Our next question goes back to Dr. Ferrer. Dr. Ferrer, the question is, how will I know when and where to get vaccinated? Will I get it at the school or do I go through my doctor?
It's a wonderful question, and I don't have a definitive answer because there are many, many ways for people to get vaccinated in the county once you become eligible. So we say once it's your turn, right now, for example, this week, there are 391 sites that are offering vaccinations across the county. Pharmacies are offering it, clinics are offering it. A Kaiser, for example, if you're a Kaiser member, you may be able to get vaccinated once it's your turn through Kaiser. We have what everyone knows now as the large capacity megapods that are throughout the county. There's actually 9 of them in our county right now that also offer opportunities for people to get vaccinated. And then there are smaller community sites that are set up. There'll be mobile teams that are set up. For teachers and staff in particular, starting March 1st, there'll be those opportunities, and you can go ahead and go to vaccinatelacounty.com. You can sign up right now and you'll get alerts when appointments are available. And that will be one way. Any place that's offering appointments, you'll be, you can, in some ways it's like the lottery. You can go ahead and try to get an appointment. But in particular for teachers and staff, we'll also have what we call closed pods. These are closed points of dispensing. And what it means is throughout the county, working very closely with the LA County Office of Education and with school districts, we will set up places that are just open for appointments for teachers and staff. Some of that will be, regional. There's some areas of the county, for example, where there are lots of small school districts, and they may form a consortium so that you could have 13 school districts working together to set up 1 or 2 sites, but they'd be closed. The only people that can get vaccinated at those sites will be teachers and staff that are affiliated with those 13 school districts. And in some cases, that will be open as well for private school teachers and staff as well. Those are decisions we work with as we set up these sites. There are other much larger school districts that, as you know, LAUSD is an example. This week, they've already started by opening up 1 site where they're starting to vaccinate teachers and staff who are 65 and older, because we can vaccinate anybody 65 and older, but that is what I call a closed pod. You cannot go there unless you're a teacher or staff with LAUSD. So the only people who can get appointments there are going to be teachers and staff. So we're going to do that. We're going to make sure that there's closed pods at our large county sites. So we have 5 large sites, 2 smaller ones. So at those 7 sites, we will probably dedicate 1 or 2 days a week that are just for teachers and staff at schools. So if you're in a private school setting where it's impossible for you to figure out where to go, you'll have, again, closed opportunity just for teachers and staff, but it won't be by district. It'll be for wider areas. But we're going to have to work on how we do the rollout. So one thing I can promise is there'll be lots of opportunities, some that will be geographically close to where you live. What I can't offer is that everyone's going to get vaccinated in week 1. As a matter of fact, that's not possible. Okay, at this point, we get about 200,000 doses a week. In just the education sector alone, there's for K-12, there's over 500,000 individuals. We also have to be vaccinating food and agricultural workers, and we have to vaccinate law enforcement and emergency responders on top of the 1.4 million people who are 65 and older. When you're only getting 200,000 doses away, doses a week, it requires all of us to be patient. We will get to everybody, but please understand, until there's more vaccine available in the country, this isn't just LA County, it will take us a while to get everybody vaccinated. So we're going to work really hard with LA County Office of Education, Dr. Duarto, and Mr. Valdez to come up with easy ways for people to understand when it will be their turn, when their district is now like in the queue to get vaccinated, when there'll be opportunities for those closed pods. But also we're going to encourage everybody, go ahead right now, sign up, vaccinatelacounty.com. Put yourself, fill out some, give them some information. They will contact you once we have appointments that are available at all of the other sites that aren't closed pods, and you can always feel free to use those sites once you're eligible. You'll have to show some verification that you're in education, but we'll be very clear about what that verification will look like, and it will be relatively easy.
Thank you, Dr. Ferrer, for that good information. I'm so glad to hear that the vaccine rollout will be inclusive of the K-12 public schools, the private schools, and also our charter schools. So thank you for that. Our next question goes to Dr. Yagana. We received this question quite a bit. They want to know what they can do to protect themselves from the virus when they are on campus and around so many other people for a long period of time.
That's a very interesting question, and I can say that as a physician working with COVID-19 infected patients last spring, I experienced a lot of the same concern about contracting the illness at my job. Luckily, we've come a long way in the last year in understanding how to prevent transmission of this virus. And I really do think the CDC guidelines, the California Department of Public Health guidelines, and the LA County Department of Public Health guidelines do reflect so much of what we've learned through researching how to prevent transmission of COVID-19. We know that there are key elements that'll keep us safe, whether we are at the grocery store, working in a hospital, working in a factory, or in a school setting. Keeping your mask on, preserving distance between individuals, staying home if you don't feel well, and getting tested if you have symptoms are really the infection prevention pillars. And I think it's also really important, like Dr. Gilchek mentioned, if you do find out that you're infected, making sure you let individuals who've been exposed know right away so they can also quarantine and get tested. We know that these strategies are incredibly effective at preventing transmission on their own. And we actually do think that vaccine will even push down that risk further. I think the most important thing, though, is to follow all these recommendations and to not get COVID fatigue, to really enforce the masking, the distancing, the hand hygiene, and staying home if you're not feeling well.
Thank you, Dr. Yagana. Appreciate all that great information. Our next question goes to Dr. Ferrer, and the question is, we know that parents are able to opt out of sending their kids back to school, but is that also extended to staff who are at high risk? I have a heart problem and I don't feel safe going back.
So, such an important question, and I know it's a big concern. I want to start by saying we're not the employers on record. So, and these are really decisions that need to get worked out with employers, as you know, employee-employer relationships. I know for some of you, you have very strong support from your labor unions on making sure that, you know, what we would call essential worker protections are being offered. I do want to say, if you look at our protocol, though, we're very clear that as much as possible, and this is at every work site, not just at schools, employers need to continue to make accommodations for people who are at serious risk, for illness, for serious illness, and even death, should they get infected with COVID-19. And so I know, for example, at our, you know, we're the public health department. Obviously, you know, we're all working at the vaccination sites now. We do outbreak management, et cetera. But for people who are at high risk here, no, they are on teleworking assignments. Many times they do have to get medical verification that they do have an underlying condition that puts them at high risk. But I encourage, all employers to really respect the fact that with this virus, there are in fact a lot of evidence that some people are at much higher risk than others, that should they become infected, they can become seriously ill. And for some people, unfortunately, they pass away. So we would be urging schools, like we urge every employer, to make those considerations. But I do want to say, that is in fact something that's usually determined with an employee-employer relationship, set of relationships, or as part of a contractual obligation. I don't know if Dr. Duarto wants to chime in, from the education side, as what your sense is about how the public districts are working.
Sure. Thank you, Dr. Ferrer. So what districts would need to do is, work through it's exactly what you said. Each district would have negotiated some type of agreement. Districts would potentially have employees go through some type of reasonable accommodation process for employees that need to have an accommodation based on health conditions that put them at higher risk. So that's going to be handled district by district, but that's my understanding is that they would go through that process of requesting a reasonable accommodation.
Thank you so much, Dr. Duarto. We are now going to go to the chat box. We only have 30 minutes left, so we want to, again, get to as many questions as possible. So our first question is for Dr. Gilchek, and the question in the chat is, will the children be tested for COVID-19 before opening schools?
The testing question. That's an excellent question. The short answer is not necessarily. Districts have a choice to make in terms of what sort of testing they wish to implement. So let's review sort of from most important to what might be less important. Testing anyone who's symptomatic in the school community is absolutely essential to get an accurate diagnosis, right, of COVID-19 or possibly something alternative. Testing people who are identified as close contacts to a confirmed case is also really essential. And those are the two aspects of testing that every single school should have a plan in place to assure that that is available. Doesn't mean the school must do the testing themselves, but their employees must have access to that testing. That's actually Cal OSHA regulations now. And students also should have access to that testing. Whether that's through their own medical provider or not is fine, but that testing is really essential. The next question is, should there be just general periodic surveillance testing of staff or students? That's done, like doing a sample of staff every couple of weeks or something along those lines. I can tell you the state guidance does not require that for any school to do. And it does have more limited value than the symptomatic and exposure testing. If you're doing testing with a low frequency or sort of a long period, right, between a person getting tests, there's a great deal of time where they could actually become a case and become infected, and the school would never discover it because it's in that month-long space, right, in between where a person gets their surveillance tests done. Then you could do testing much more frequently, right? Like do testing of every person every week, or even more than twice a week, right? And in that case, you're much more likely to find, if not all the cases, most of the cases. But I think here's the most important message I can give about that, about those sort of testing regimens. No amount of testing can guarantee that a person with COVID-19 might be in your school campus or might show up to school. Obviously, a large percentage of cases are asymptomatic, so a person wouldn't know. I mean, the first screen or filter should be if you're ill, you don't come to school, right? If you have symptoms, you don't come to school. That's a great way to keep a large number of cases out of the school. But a lot of cases are asymptomatic, and you wouldn't know unless you tested. But even with testing, you may not identify every case. And even, let's say theoretically, you were testing people so often that you identified every case. Well, that's very helpful, but if the infectious period starts like 2 days before symptoms start, or starts 2 days before the actual test is done. So even if you've identified every single case quickly with some sort of testing regimen, there still could be exposure because there's maybe a couple of days of infectious period before the test even turned positive. So the most important message for me with this question that I would impart is no testing regimen can completely keep your campus safe, and all of the other mitigation measures and safety strategies that I talked about in my opening comments are by far the most important ways to keep people on campus safe and to limit, if not completely eliminate, cases of COVID-19, to greatly limit or eliminate transmission of COVID-19 at your school. So those things are the most important, honestly: the masking, the physical distancing, the stable cohorts, the hand hygiene, the ventilation. I know this. So as I say, the state doesn't require any particular asymptomatic testing regimen. They have some recommendations in their guidance about how frequently one may want to do it, but they do not require it. They recognize that all of the other safety measures, especially when done together, are more important and more effective. Similarly, the CDC guidance, which came out just a few days ago, does not emphasize testing. It emphasizes masking, it emphasizes physical distance, it emphasizes hygiene, it emphasizes cleaning and disinfection. It discusses testing, screening testing as a consideration, as a recommendation, but not the most important thing to do. Lastly, the question was specifically about children. And in this case, because we are now bringing the youngest children back, right, TK through 6, and we do know children certainly can get infected, but have a lower risk of infection, a lower risk of illness, and apparently a lower risk of transmitting to others. I can say even in consultation with experts at the state, they did not think it was necessary to test all children. When we bring back older children who may get infected and transmit a little more like adults do, they don't get very ill, but they certainly can get infected and transmit the virus to others. It might be time to reconsider the importance of testing students at that time. But I think at this point in time, probably not necessary. And although it is a school's decision or a district decision, I don't know if many districts will actually do that. Thank you.
Thank you, Dr. Gilchick. Appreciate that answer. It looks like those safety practices are going to be with us for a while. And it looks like those practices have gotten us to this point where we're able to open up. So that's a great thing. So thank you for that. Our next question is for Dr. Yagane. Here's the question. How is the health department addressing concerns of new variants that are more contagious and more harmful to people? Are the new strains a concern for the safety of the students? It seems like the new strains are affecting children more.
Thank you for that question. This is a hot topic, obviously. Many of you know that when we had the winter surge in cases, we are finding that the virus is mutating in a way to give itself a survival advantage. And one of the variants that has come to light is the B117, or the UK variant, which is associated with a higher transmission rate and possibly higher or increased mortality, although that data is still being analyzed. As far as its effect on children, that's still being investigated. I have not seen any confirmed evidence that it is actually more dangerous to students. But in any case, I think the best way to address it is to do what we've been trying to do all along. If the virus doesn't transmit, it doesn't have a chance to mutate. So the most important things we can do is to bring our community rates down, to do everything we're doing to decrease transmission. And I won't go through them again because I feel like we're on auto repeat, but the masking, the distancing. Also, we know for the UK variant, the vaccines are highly efficacious. So the vaccine should cover that variant. Most of our therapies also are very effective against the UK variant. There is a South African variant that has also emerged, and we do have cases in the United States and a few cases in California as well. That one, the mutations are more on the spike protein and maybe can affect the vaccine response. That being said, it seems like the vaccine you will have a response if you're vaccinated. So that's the good news. And again, if you use the infection prevention protocols we've all been promoting, you can also prevent the transmission of this variant. So again, whatever we can do to decrease community spread of coronavirus is really the most effective way of controlling the variants.
Thank you so much for that, Dr. Yagana. Appreciate that. Our next question is for Dr. Duarto. And Dr. Duarto, the question is, seeing as how the school year is only about 3 months away from being over, is it worth it sending students back for a short period of time? You might be on mute, Dr. Duarto.
Everyone agrees that the best form of instruction is in-person instruction. And there's no question about that. Students need to be in school. They need to be with their teachers. They need to be with their friends. They need to have the resources that schools provide, and they need to have that presence. So I would say, yes, it is worth it. We're also looking at ways of extending the school year, providing more support to catch students up from the loss of instruction that they've experienced. We've brought groups of educators, superintendents, and other educational experts together to really look at this loss of instruction and to find many ways that we can catch students up, especially for those that have been disengaged during this pandemic. We know that we've seen more low-income students whose parents may be essential employees or may not have the luxury of working from home that have been more impacted, more disengaged, babysitting younger siblings. So my response to that is even if it's 3 months left to the year, there's a lot that we can do to support our children and our families and our educators with the time that we have left.
Thank you so much, Dr. Duarto. Our next question goes to Dr. Ferrer. And Dr. Ferrer, the question is, what about cities where the transmission is still widespread and over 25 per 100,000?
Thank you very much. And you know, it's when you're in a county as large as ours, you know, we're really larger than like 40 states. These are very important questions. You know, sort of what is the impact of what we would call sort of variations by geography? And if you look at our maps, and we put them up all the time, from the very beginning of this pandemic all the way through now, some cities have and neighborhoods and communities have been much harder hit than others. Often those are in fact communities where there are large numbers of essential workers. Often those are communities where people with less resources are living, and they may be living in situations where there's what we call multi-generational families living in more crowded housing situations. And then there are other communities that really don't have those conditions. Lots of people may have more resources. Many people have been able to work from home, work remotely. or they're not working at all. And they in fact have seen lower infection rates. So, first thing I want to do is just make sure that we all understand that when we look at our data, the rates of infections in the hardest hit communities are not really driven by personal behavior. Because sometimes people think like, well, this is all about the way people are behaving. In my community, we don't have a lot of transmission and we're all behaving like perfectly. So it must be that in other communities, people are just not paying attention. That's really not the case. When we look at the data, we're able to actually see that in the communities that have been the hardest hit, it's because the people there have, for the most part, never stopped working. They've been our essential workers. And at the beginning, we actually didn't know how to really protect all of our workers. We didn't know about asymptomatic spread. Remember, February, March, nobody was wearing a mask. And what a big deal it was when we told people they needed to wear a mask and how many people refused to wear a mask. So all that time, we had a lot of people becoming infected because there was a lot of asymptomatic spread. And it's very hard once those community rates go up to drive them all back down without a lot more effort on the protection side, which is what we've really been trying to do. Worker protections are absolutely essential in slowing the spread. One of the most essential things is protecting workers at their job sites. But in communities, and oftentimes in communities where there may be less community transmission right now, I want to note that it is rare in any school building that the only people in your building are all people who live in the same community. I'm sure there are examples in smaller schools where it is really just a community, a pretty contained group of folks. They're all living in the neighborhood, everybody going to the school and everybody working at the school. My experience has been that that is really not the reality in most school settings. In most school settings, you have workers coming in from all over the county and sometimes from outside the county. And many workers are in fact in the communities that have the lowest transmission rates. Many of the workers don't live there. They live in other communities and surrounding neighborhoods, and they may in fact be coming from communities with higher rates. So it's really hard to sort of say we're in a bubble over here and we should get treated differently. I like to say, we're all in this together. The best thing we can do for each other is drive the rates down everywhere and pay attention to the fact that we're not in bubbles. And unless you're staying home all of the time, you're going to have exposures when you go out of your house. And the best way to really limit risks for yourself and the people you love is to limit risks to other people that you don't even know. So, I would say that's why we don't go by like what's in one city when we're thinking about opening up a sector, a work sector, because we know for most employers, all the workers rarely live in that one city. Now, there are exceptions. There are small schools, there are small workplaces where this may not apply, but for most of the schools, I think what I'm saying is the reality that the people who are working there, the people who are teaching there, don't necessarily live in the same community where they teach and where they work.
Thank you, Dr. Ferrer. Appreciate that. Dr. Gilchek, this next question is very important to teachers and students. And the question is recess going to be allowed?
Yes.
Yes. I'll expand. I could stop there, but no, absolutely. I appreciate the question. I wouldn't say it's allowed. I'd say it's essential. So we have to find a way to make that work. Not only do our students need a break, some time to relax and clear their heads and maybe play a bit, but not too close to each other, but have some fun. But teachers need breaks too. And although and that's why our protocol actually includes some allowances, some accommodations, which technically may break the the letter of the stable group, but absolutely we allow for like substitutes and floaters to work with a group so that again teachers can have break time. They don't have to be literally with that group for the entire 8 or 9 hour day or 10-hour day, or I know you guys work so hard. So yes, so the answer is yes. Again, it's still important when the group goes to recess. They still have to maintain physical distance. They still have, I sound like a broken record, but this is how we're going to keep everyone safe. And that's why we all keep saying it. They still have to maintain physical distance. You know, they still have to mask if they're in any proximity to each other. So and they still need to be separate from other groups. That's what I was trying to get to. That's what the stable group means. It means, number one, the membership of the group doesn't change or changes as little as possible over time. Two, the group does not mix with other groups. So those are the parameters that need to be followed during recess, but it can be done, you know, with a little bit of creativity and teamwork, and teachers can get some recess time and students can get some recess time, and then everyone can focus, right, during instructional time throughout the day. So the answer is yes, and I'll stop there.
Thank you, Dr. Gilcheck. We only have about 9 minutes left, so we're going to go as quickly as we can to get to some of these other questions that we have. The next one is for Dr. Yagane. Dr. Yagane, how can someone tell the difference between a common cold and COVID-19?
So the answer for that is to get a COVID test, and that's really the only dependable way of being able to differentiate between the two. For children, I guess I should say for children, often they can be asymptomatic. They can just have clear congestion, but most of them will, if they have symptoms, the most common symptoms are fever, cough, vomiting, and diarrhea. So those are the symptoms we mostly screen for.
Thank you, Dr. Yagane. The next question goes to Superintendent Dr. Deborah Duarto, and the question is, I've heard reports from other teachers in different districts that hybrid is really difficult. How will the districts take care of its teachers to prevent further burnout from everything we've had to do during distance learning?
First of all, I really want to say that we all appreciate our teachers and all of our employees that have been working so hard during this pandemic. I mean, teachers have had to go from their traditional style of teaching to remote teaching, learning, a whole different way of doing things. And I just think our teachers and all of our school employees are heroes. So I want to say that. Districts have been working very hard since they've had to shut down schools, and they've been planning on how they would bring students back and the form of instruction that they would use. So I know that the 80 superintendents that I've been interacting with have been very concerned about making sure that they have professional development in place, that they have significant support and resources in place, because we realize that it is difficult when we had to close down, and it's difficult when we have to reopen, and when you have a hybrid program in place. That's going to take some additional training, but the important thing is that districts are planning and that they're prepared to avoid any kind of confusion, making it very clear of exactly what the expectation is of their teachers.
Thank you so much, Superintendent Duarto. Dr. Ferrer, our next question, what happens if teachers do not want to get vaccinated? Is it mandatory?
It's not mandatory to get vaccinated, and we want to also always be very respectful. Everybody has a right to make that decision for themselves and within their families. We do encourage people when they're thinking about whether to get vaccinated or not to go to a trusted source for information about the vaccine. You know, we have a lot of information on our website about the vaccine, about the trials, about the safety measures that were taken in developing the vaccine. And we do encourage people to you know, feel free to take that information, read it. It's in multiple languages as well. We also encourage people to talk to people you trust. For some of you, that may even, in fact, mean talking to other people who got vaccinated about their experiences. I mean, we would not, as public health people, be promoting are spending all of this time organizing vaccination sites and vaccination clinics if we didn't think ourselves that it was safe and effective at reducing what's most important right now, reducing serious illness and reducing the number of people that are dying. We feel that way, but everyone does have the right to make up their own mind. And no, it's not mandatory from us. In other words, us as a public health department, we are not making it mandatory, and we won't, because for one reason, right now it's what we call a vaccine that's under emergency use authorization. It hasn't been what we would say fully licensed. And I don't know of any other example. I was trying to think about this the other day, where a vaccine has been made mandatory by a government agency or a government department while it was under emergency use authorization. Obviously, we're in the middle of a pandemic and we have to really use all the tools we have. But as with most vaccines, they're going to continue to give us good information from the research that's ongoing about the vaccine's efficacy, which is one of the questions that people are most interested in. If I get vaccinated, I know I'm not going to get really sick. I know I'm not necessarily I'm not going to die, but can I pass this infection on to somebody else? In other words, can I be asymptomatic, not know I have it, because I'm not going to get seriously ill, or I might get no symptoms at all, but will I be able to shed enough virus that somebody else could be infected? So we still have to find that out. We don't think it's likely, but we need more definitive answers. So no, the Public Health Department will not be mandating this vaccine. That said, private employers can in fact go ahead and make this vaccine mandatory. So again, I want to say from the government's perspective, we have no intent here as the local Public Health Department to mandate the vaccine. We think it's our job to make sure everybody in our community has good information. You feel like you have a place to go if you have questions. You can go to our website. You can participate in events like we're holding tonight so that you can make up your own mind about what you think makes most sense for you. Unlike other things, we do mandate that you wear a mask. We do mandate that you keep your distance from other people. So there are things that we feel very confident saying you absolutely have to do this. This is the way we're going to protect each other. And while we think vaccinations is an important tool, it will not be mandatory at this point in time from the Public Health Department.
Thank you, Dr. Ferrer. We're almost out of time, and so what I'd like to do is give each of you an opportunity to provide some final thoughts, and I'd like to go in the reverse order. So I'd like to ask Dr. Yagane for some final thoughts.
Yeah, I just want to end with saying thank you to all of you again for the grace and patience you guys have all shown. I know it's been a long waiting to get the vaccine, and I'm really excited that we're able to offer this additional layer of protection on top of hopefully what will be a safe transition to in-person schooling.
Thank you, Dr. Yagana, for everything that you continue to do for all of us. Next up, Dr. Gilchek, final thoughts.
Yeah, thank you, Mr. Valdez. It's been a very enjoyable 90 minutes, and I'm glad that I could be here to speak to all of you. I just want to say that I think that we have learned so much in the lab. We still have a lot to learn. It's still a new virus, right? It's only a year old, but we've learned so much in the last year, and we know so many things we didn't know last spring and last fall, and we are convinced that schools can open safely, and we know how to do it safely, and everyone can be safe at school: students, teachers, other staff, administrators, so on and so forth. If we all work together and comply with what we know works, schools can open safely even without vaccination, which is not to say that we don't want to get every teacher vaccinated as quickly, teachers and other staff, pardon me, but every employee vaccinated as quickly as we can. We do, because the vaccine is really important, but we can be safe even before everyone gets vaccinated. So I'll stop there. Thank you.
Thank you, Dr. Gilchick. I wanted to thank you for being such a great partner with Laco and a great communicator, so thank you for that. Superintendent Dr. Deborah Duarto, final thoughts?
Again, I want to thank everyone. It's been a tremendous year. And as Dr. Gilchick said, we've learned a lot. We've been meeting regularly. We've been planning and preparing. And our number one priority is the safety of our students and our employees. So I just want everybody to know that we're working really hard to make sure that we keep everybody as safe as possible when we look at reopening schools. And I want to thank Mr. Valdez for being such a fabulous MC. Thank you.
Thank you, Dr. Duarto, for your leadership at Laco and moving this forward. What a great partnership. Finally, Dr. Farrar, final thoughts, please.
Yeah, thank you. I want to echo thanks also for Mr. Valdez. Always wonderful to be anywhere with Mr. Valdez. I think he really brings so much leadership to the work we've been doing. I also want to thank everybody who's joined us tonight. Really appreciate you're taking time. You're helping us learn as well what it is that's worrying you, where your concerns are. I think our job right now is really to support teachers and staff, parents and students. And I also understand there are very difficult decisions that people are making right now in reopening schools, in deciding whether to send children back to school. We are still in the middle of a pandemic, and for some of us, this has been a very, very devastating time. And there's still a lot of fear and a lot of reason for people to be fearful, and so I want to just thank everybody for showing grace, really trying to work together, because as I've said before, schools don't open successfully, no matter what we write and put in protocols, if people who are part of that school community don't want to come together to do that work right now. And that's actually okay, because what you don't want to do is you don't want schools opening where the people that are going to be in the building aren't able to work together to create an environment that's as safe as possible. So I think we have to move forward respecting everyone, trying to provide good information, trying to be sources of support. Our commitment to you is if you are opening for any services at all, we're here to help you. And with that, I want to thank. I also want to always acknowledge and really be so grateful for Dr. Duarto and her leadership during these most challenging times. So thank you very much.
Thank you, Dr. Ferrer, for the strong shoulders and leadership that you have always put forward. It's been a pleasure working with you as partners. I want to thank the panelists. I want to say that no one will ever accuse this panelist of being short on an answer. It was very detailed. If I was your teachers, I would give you an A for completeness of answer. So thank you for that. But I'm sure, panelists, you will agree that most of all, we want to thank everyone that's out there, the educators, the teachers, the paraprofessionals, psychologists, our nurses, our social workers, our cafeteria workers, our bus drivers, especially our facilities maintenance folks, our principals. Thank you for everything you do every single day to make this all possible. We appreciate you and recognize you for the hard work that you're doing. With that, I want to thank you all for participating. I want to thank you for the information that we have all been sharing with each other. We will continue the communication. And with that, I'd like to bid everybody a very good evening. Be well, and please be safe out there. Thank you.
Thank you.